In Zimbabwe, the past sample transportation system faced significant hurdles, creating barriers and inequities in accessing essential treatment services across the country. Fragmented and parallel systems led to high costs and inefficiencies, delaying results and treatment decisions for patients.
Before we developed the system, we had no formal sample transportation system. So we had a haphazard way of transportation of samples. One of the biggest challenges that we had was turnaround time for results. Samples would take long to get to the testing hubs. Then also results would take long to go back to the testing sites, to the clinicians, and also it would take a lot of time for the results to be used for clinical interventions. We had no way again of tracking samples along the way, and a lot of samples would then be lost.
For people living with HIV, these delays prevented timely adjustments to their treatment schedules. Prolonged use of ineffective medication allowed the virus to replicate, developing drug resistance and increasing the risk of opportunistic infections. The frustration of waiting for results often led to poor treatment adherence or abandonment.
Kare taimboti kana taturwa ma-viral load viral raizonzana toshanda totorwa futi tichidzokorogwa tichidzokorogwa. Fanika ini kwandiri kure izvozvi kuti ndisvike panapa ndakwira $5 kuya kuno, chipatara chiri kure, saka chipatara changa chitafanika kuti chakasarira, asi tanga tisingazivi kuti chichazotifambira zvakanaka sezvizvi.
In 2021, the Global Fund, through the UNDP, invested in harmonizing these fragmented systems under the Integrated Specimen Transportation Program, with a budget of $3.7 million under Grant Cycle 6 and an additional $5.1 million for Grant Cycle 7.
As a collective partnership, that's how we think we should be able to support the ministries and other departments of government to achieve the goal that have been outlined in the Zimbabwe National AIDS, HIV and AIDS Strategic Plan.
The U.S. Centers for Disease Control and Prevention, CDC, and the United States President's Emergency Plan for AIDS Relief, PEPFAR, works closely with the Ministry of Health and Child Care to strengthen laboratory systems that can accurately and rapidly respond to diseases of public health concern. To date, PEPFAR has invested close to $12 million towards establishing the National Integrated Sample Transport System, which serves 44 districts in Zimbabwe.
Through this program, we've contributed a lot. It's cost efficient and it's very innovative, having your riders transporting from the districts, from the different clinics to the districts, and then from the districts to the different provincial laboratories, so that there's a system that has been put in place that ensures efficient and fast delivery using riders.
The AST system has supported the viral load scale-up program because we are now getting an increase in the coverage within the districts, and because we are releasing results in a shorter period or a shorter TAT, there is increased confidence within the facilities, within the clinicians, customers. So now we are also experiencing better outcomes in patients because they are receiving their results in time, and the clinicians are then able to manage the patients.
Kudhara aitononoka kuuya zvokuti dzimwe namba unotopedzisira watokoshiwa kuti ndakati rwarini asati auya ma-results.
When we started the full collaboration on this IST initiative, you realize that it takes about 4 to 6 months before the sample collected translates into meaningful results on the ground. But now it takes just about 72 hours, which is 3 days.
The system now comes with a sample transportation tracking system. You can actually track where the sample is. as it is ferried from the lower levels to the upper levels. We also now have an electronic turnaround time for results, where results are sent electronically to the clinicians, and also some messages are sent straight away to the patient to say that your results are out, you can now visit your clinicians. So this system has really improved our laboratory systems in terms of testing, and now we can account for most of the samples. And also in terms of quality management system, we have seen some of our indicators performing very well. For example, the rejection criteria, which we also use to see the performance of the labs, and also the turnaround time. They have really improved a lot because of the system.
PEPFAR is about saving lives, and the progress we have made with IST has been phenomenal. Through PEPFAR support, more than 1,600 facilities can now readily access laboratory services, resulting in timely medical interventions. This enables over 1.2 million people living with HIV to live healthier and longer.
Implemented by the Ministry of Health and Childcare in collaboration with its implementing partner BRTI, the National IST program uses a hub and spoke model. Laboratories at district or mission hospitals serve as hubs, receiving samples from lower-level facilities, or spokes numbering to over 2,000 facilities organized into 341 clusters. These clusters are served by 280 motorbikes and 8 provincial vehicles, supported by both the Global Fund and PEPFAR.
I work for the Ministry of Health and Childcare under the IST program. I ride my bike to collect specimens from the clinics back to the hub, and I also collect patient results from the hospital to the clinics. When I first started riding, it was a bit challenging for me to ride because I wasn't used to riding. I just knew how to ride, but I wasn't used to riding such long distances on a daily basis. We have a scheduled visit line, which we use on average. A rider visits about 4 or 5 clinics per day, and an average of around 120, 130 kilometers on a daily basis.
On a Monday, clinics use out kushenda anditika ema-kilometers acho. Saka patoma few pepe tutomwatisa kuti ndikufamba kilometers 162 ndinomwa 5 liters.
This is a male-dominated thing. It's just people are just used to the male person riding a bike, and they don't feel like a woman should ride. In other areas, they were like, how can a woman ride? Is this your bike? Are you the one who came with this bike? As time went by, as the years moved, I gained more experience with riding, and people now know me everywhere because I'm on the road every day. I'm an inspiration to other people, especially to my daughter. She's so proud of me. She's like, I want to be like you. You are my role model. I want to learn. But she's still young. She's learning. And I'm actually encouraging her to learn to ride.
IST riders are more than just couriers. They are trained clinic laboratory interface change agents, acting as the link between the clinic and laboratory. They check patient details, sample integrity, and labeling upon collection, significantly reducing specimen rejection rates and preventing delays. They also package the specimens accordingly, observing the necessary temperatures for transportation.
The cooler box has a biohazard container inside to carry the whole blood samples and ice packs. It also has a thermometer installed on the cooler box to monitor the temperatures, so that I have to maintain cold chain for the whole blood samples, and also to maintain the 6-hour period for sample collection to sample separation. So that I think the integrity of the sample should be maintained so that we don't have biased results.
In areas with human-wildlife conflict, the IST program uses the provincial IST vehicles to ensure the safety of riders and the timely collection of samples.
With these resources, we've procured over 190 motorbikes, and we continue to support bike maintenance, riders training, fuel, modern tracking systems, as well as the experts that make sure that the system continues to run optimally.
The Global Fund's support extends to providing triple packaging materials for proper specimen integrity, laptops and tablets for data collection and management, emergency motorbike repair kits, and riding gear for rider safety, and all these contribute to an effective and properly managed transportation system. Effective collaboration between the Ministry of Health and Childcare, UNDP, PEPFAR, BRTI and all the various stakeholders remains paramount to the continued success of the IST program. This combined effort ensures a robust healthcare system with efficient specimen transportation, ultimately leading to better patient outcomes.
We have managed to integrate with other systems. For example, waste management. As the vehicles ferry samples, we also now ferry the waste that might need to be incinerated at referral laboratories at very high temperatures. For example, the waste that contains cyanide, it needs to be destroyed at about 1,000 degrees Celsius.
The contribution of BRTI has been immense in terms of implementing, but working hand in hand with the Ministry of Health and Childcare, mainly with the Directors of Lab Services.
The benefits of a successful IST program like the one we have in Zimbabwe goes beyond the HIV program, but benefits the communities at large as we are increasing access to diagnostic services.
The overarching objective is strengthening the health resilience system in the country. We strongly believe together in synergy, 1 + 1 will always be greater than 2. And that's why we really appreciate the role of the ministry as the leader of the entire process.
We are really happy that this system has worked, and also the funders are happy with the results. Hence, we are now showcasing the system to other countries on how we have developed it and how it has changed the landscape of testing in country.